Our general advice is for people doing travel, international, is to be informed and look at where you're going, what the aspects, talk to your agents, talk to your airlines, talk to your, if you're doing cruises like that, you need to ask those questions. And you need to be assured that any risks are dealt with within your level of satisfaction. And so we haven't put on bans of travel. We've asked people, and the health FAC has said, if you non-essential travel to China, you should postpone that. We haven't said to other countries yet. We'll wait for advice from WHO and from FAC to say, now we're asking people not to travel to country X and Y and whatever. But I think that in this light of this current event that's going on, it behooves the public, who are doing the traveling public, to be informed and to do their own assessment of the situation before they invest not only their time but their money and their health in such events. So some travel is quite safe. I'm not limiting travel to BC or down to the States and that kind of aspect. So there's different levels and different concerns.
But should people be wearing masks on planes and that type of thing? Or is that just useless?
We've said before, when wearing masks in the general public, we have not endorsed that.
Specific enclosed, more likely to be infected atmosphere.
Yeah, the evidence on the general public using masks as a method by which to protect themselves from the potential spread of infectious disease is very weak at best. If there is evidence for mask use, it's for healthcare workers who are actually taking care of sick patients, and there is some evidence for the benefit of masks for somebody who's actually sick in terms of preventing the spread of their illness to others. However, I would suggest to you that with respect to the traveling public, Dr. Williams is quite right. There are travel advisories. It's worth researching the country and relying on the Public Health Agency of Canada and the Government of Canada websites. They do provide quite a bit of information in respect of travel. And of course, the same advice that applies here applies when you're overseas. Wash your hands frequently with soap and water. Right? Use alcohol-based hand sanitizer. All those good pieces of advice around good respiratory hygiene, those still apply, and one might even argue perhaps apply more when you're out and about and traveling.
Just on travel, we're coming up to March break. There are going to be thousands of Canadian families traveling all over the place, probably going to, cruises or resorts where there's going to be large clusters of people. Are you anticipating that after mass travel like that we're going to see either an increase in cases? And what would you say to people that they should specifically be looking out for in countries that don't have any cases of the coronavirus right now?
And again, whether it's now or in 2 or 3 or 4 weeks, the situation's changing. So as Dr. Davila said, check with those, check the advisories and that. A lot of people in March break go down to the States and areas like that. And is that a concern? Right now we don't believe it's a concern to go to the States and that kind of stuff. So again, families and those are going to have to make those decisions. And I have people ask me that I've already have some going to high areas. Say, what should I do? And I said, well, you're going to have to reassure yourself, make sure your information's correct, and is this the right decision to make, yes or no?
What should you be looking out for, though, specifically? I mean, you said that, there's lots of places where you can get information on the destination that you're going, but what should you be looking out for that would give you that satisfaction and peace of mind?
Well, if you do your travel advisories, and the experts like WHO and others have said, if they have concerns about the ongoing activity within the country, if it's spreading and there's certain areas at risk and they're not convinced of the quality of the containment, that would be very much concerning to you in that situation. So, and we've seen some more countries come on just recently. We've added 4 or 5 others. And as the executive director was concerned, it's about a month ago, 3 weeks I should say, when they put out the notice, their concern is some countries is the response in this situation and their facilities robust enough to carry out a proper containment process. And that was what the emergency was declared for, to ask those ones to do their own inventory and their own assessment and to come forward to WHO and saying, we have limitations, we're not able to respond, and the WHO says, okay, we'll try to move alongside and assist you in this regard if and when it does occur. So there's what you do know, but more concerned, as you say, try and fill in the gaps of what you don't know.